When we look at a person's face, one of the first things we notice is their eyes. Eye prominence refers to how much the eyes protrude or recede in relation to the surrounding facial structures. It's a subtle yet significant aspect of facial aesthetics that can greatly influence a person's look. Some people have eyes that seem to pop out, while others have eyes that appear more sunken or deep-set. These variations can dramatically alter the impression a face makes. The degree of eye prominence can affect how we perceive age, ethnicity, and even personality traits. For instance, prominent eyes might make a person appear more alert or expressive, while deep-set eyes can lend an air of mystery or intensity. Understanding eye prominence is not just about aesthetics, though. Certain conditions can cause changes in eye prominence, and being able to recognize these changes can be crucial for early diagnosis and treatment. Whether you're interested in beauty, health, or simply curious about facial features, eye prominence is a topic worth exploring. Let's dive into the two main types of eye prominence: deep-set eyes and prominent eyes. Deep-set eyes sit further back in the eye socket, appearing smaller and more shadowed. Think of Clint Eastwood or Angelina Jolie. Their deep-set eyes are distinctive. Prominent eyes protrude more, making them appear larger and more open. Celebrities like Marty Feldman or Amanda Seyfried are known for their prominent eyes. Neither type is better, they're just different features contributing to unique aesthetics. The difference also affects eye function. Prominent eyes might be more susceptible to dry eyes. Deep-set eyes might have a wider field of vision. Most people fall between very deep-set or very prominent eyes. Several biological factors play a role in determining eye prominence. One of the primary factors is the shape and size of the eye socket, also known as the orbit. A deeper or shallower orbit can significantly influence how prominent the eyes appear. Another crucial factor is the amount and distribution of fat around the eye. More orbital fat can lead to more prominent eyes, while less fat can result in a more deep-set appearance. The size and shape of the eyeball itself also play a role in eye prominence. Larger eyeballs naturally protrude more, leading to a more prominent appearance. Interestingly, there are also some differences in eye prominence between males and females. On average, men tend to have slightly deeper-set eyes than women due to differences in skull structure. However, it's important to remember that these are general trends, and there's a wide range of variation among individuals of both sexes. When it comes to eye prominence, what's considered normal can vary. However, there are some standard measurements that doctors and researchers use to quantify eye position. One of the most common measurements is the distance from the lateral orbital rim to the front surface of the cornea. This measurement is typically taken using a tool called a Hertel exophthalmometer. In general, a measurement of 16 to 21 millimeters is considered within the normal range for adults. It's important to note that what's considered normal can vary based on factors like ethnicity, age, and sex. Another important factor in assessing eye prominence is symmetry. A significant discrepancy between the left and right eyes can be a sign of an underlying condition. Section 5. The Hertel exophthalmometer, a precise measurement tool. The Hertel exophthalmometer is a crucial instrument in measuring eye prominence. Named after its inventor, Swiss ophthalmologist Otto Hertel, this device has been the gold standard for measuring eye protrusion since its introduction in the early 20th century. The Hertel exophthalmometer consists of two mirrored prisms mounted on a horizontal bar. The bar is placed against the lateral orbital rims of both eyes. The examiner then looks through the prisms and aligns a scale with the apex of the cornea. This gives a reading of how far forward the eye protrudes from the orbital rim, typically measured in millimeters. One of the key advantages of the Hertel exophthalmometer is that it allows for simultaneous measurement of both eyes. This helps identify any asymmetry between the two eyes. Despite the advent of more advanced imaging technologies, the Hertel exophthalmometer remains a valuable tool in clinical practice due to its simplicity, reliability, and cost-effectiveness. Section 6. Orbital vector, another important measurement. The Hertel exophthalmometer measures the forward projection of the eye. Another key measurement is the orbital vector. The orbital vector is determined by drawing two lines on a side view image of the face. The first line runs from the cornea to the orbital rim, and the second line runs to the most prominent part of the cheek. The angle formed by these lines is the orbital vector. A positive vector means the cheek projects further than the eye. A negative vector means the eye projects further. the orbital vector can change with age, leading to a more negative vector. Section 7. Surgical options for achieving deep-set eyes. For those seeking to change the prominence of their eyes, there are several surgical options available. One of the most common procedures is orbital decompression. This surgery involves removing some of the bone or fat from behind the eye, allowing it to sit further back in the socket. Another option is the use of orbital implants. By carefully placing implants along the orbital rim, a surgeon can create the illusion of a more recessed eye. These procedures are complex and require a high level of skill to perform safely and effectively. They also come with potential risks and complications, like any surgical procedure. That's why it's crucial to choose a board-certified surgeon with specific experience in oculoplastic surgery if you're considering these options. Always consult with a qualified surgeon to understand the best approach for your individual case. Section 8. Orbital decompression. A detailed look. This procedure involves removing bone, fat, or both from the orbit to allow the eye to sit further back in the socket. There are several approaches to orbital decompression, each with its own advantages and considerations. The most common are the transconjunctival approach through the inside of the eyelid, the transcaruncular approach through the inner corner of the eye, and the endoscopic approach through the nose. During the procedure, the surgeon carefully removes small amounts of bone from the orbital walls. In some cases, orbital fat may also be removed. The goal is to create more space in the orbit, allowing the eye to naturally settle back into a more recessed position. One of the challenges of orbital decompression is achieving symmetry between the two eyes. Post-operative care is crucial, as there can be significant swelling in the days and weeks following surgery. Patients typically need to follow a strict regimen of eye drops, and may need to sleep with their head elevated to minimize swelling. Section 9. Orbital implants enhancing eye depth. Orbital implants work by adding volume to strategic areas around the eye. This technique can be particularly effective for patients who want to improve the relationship between their eyes and cheeks. Orbital implants come in various shapes and sizes and are typically made from materials like silicone or porous polyethylene. The implants are carefully placed along the orbital rim, usually through small incisions hidden in the natural creases of the eyelid. One of the key advantages of orbital implants is that they can be customized to each patient's unique facial structure. The surgeon can shape and position the implants to achieve the desired effect, allowing for very natural-looking results. The recovery time for orbital implant surgery is typically shorter than for orbital decompression, but patients still need to be prepared for some swelling and bruising in the weeks following the procedure. Always consult with a qualified surgeon to understand the best approach for your individual case. Section 10. Considerations for those seeking eye prominence surgery. If you're considering surgery to alter your eye prominence, there are several important factors to keep in mind. First and foremost, it's crucial to have realistic expectations. While these procedures can certainly make a noticeable difference, they won't completely transform your appearance. The goal should be enhancement, not radical change. It's also important to understand that these surgeries come with risks. Potential complications can include infection, bleeding, changes in vision, and asymmetry. That's why it's absolutely essential to choose a highly qualified, board-certified surgeon with specific experience in oculoplastic procedures. Both orbital decompression and implant surgeries require a significant recovery period. Always consult with a qualified surgeon to understand the best approach for your individual case. Section 11. The importance of professional guidance in eye aesthetics. When it comes to altering eye prominence, whether through surgery or non-invasive methods, professional guidance is absolutely crucial. The eyes are not only a central feature of our appearance but also complex and delicate organs. Any changes to the eye area should be approached with caution and expertise. A qualified oculoplastic surgeon or ophthalmologist can provide a comprehensive evaluation of your eye prominence and overall facial structure. They can help you understand what's truly achievable and what might be the best approach for your individual case. This might involve taking precise measurements, analyzing your facial proportions, and discussing your aesthetic goals in detail. It's also important to remember that what looks good on one person might not suit another. A skilled professional can help you understand how changes to your eye prominence might affect your overall facial harmony. They can also discuss alternative options that might achieve your desired look without the need for surgery.